Paul, it's Dr. Buford. I'm here with Lauren and the rest of the shoulder team. We're just getting started. Is the mic? Okay, great. Okay, we're just getting started on your right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. Right now we've got a shaver in just to take away some of this torn labral tissue. And as we rotate and look up, you can see the biceps, and the biceps anchor is frayed, and you had some biceps symptoms. Rotate down to about 7. You've had some biceps symptoms, so we're going to do a biceps tenodesis here. Partly because I don't think your symptoms are coming from the rotator cuff. As we look up here at the rotator cuff over to the left and up at about 11 o'clock, you can see there's just some minimal fraying, but really no significant tearing on this articular side. So that's good news. And that's why we think it's much more likely that the biceps, this chronic biceps tendonitis that you've had, is the main culprit here. So we're going to go off on the video and get to work on the biceps next. Okay, so there you see a spinal needle coming through the biceps tendon. We're going to pass a wire called a super shuttle through that needle right there. Then we'll go ahead and grab hold of the wire, back the needle out, and then we're going to load that with the high-strength suture. This is kind of the first half of our tenodesis. Okay, the second half is going to be very similar in that we're going to pass that needle through once again. And now we're going to pass that super shuttle through the needle. This time we're going to pass a bunch more of the relay through. Still passing the relay. And now the secret to this technique is we're going to slip or sneak behind the biceps here. And take this one point. We're going to sneak behind the biceps here to retrieve the relay. And now we're going to load that with the other half of that suture. And this time when we pull back, you'll see how that gives us a nice hold on the biceps tendon here. I'll pull tight on the sutures, and there you can see we have a nice hold on the biceps tendon. So now we're going to take a pair of scissors and cut that at its base, right down here. Okay, so here we are looking down the front of the shoulder. You see the subscapularis tendon here. This is the middle glenohumeral ligament crossing it. And then as we look farther down the front, you can see the anterior labrum. Looks pretty good. The anterior band of the infraglenohumeral ligament, which is a ligament we often worry about in our patients that have dislocating shoulders, that looks pretty good. As we come around to the back, you can see the posterior labrum. You didn't have any instability, and the reason I say that is because your shoulder looks kind of like you've had some instability in the past, but for whatever reason that's stabilized now. And now as we look up here, you don't see anything else to really worry about, and you can see where the biceps is no longer going to be an issue here. So we're going to finish up inside the joint and get to work on any bone spurs, and finally we have to tie that suture for the biceps tenodesis. All right, recording. Okay, Paul, so we're looking in at the decompression. The top of the screen here is the acromion, and it looks flat now all the way to the front. Your clavicle, which we've taken care of the undersurface, your clavicle is right over there. You can just now see it because we took off a medial spur, and we've made sure there's plenty of space underneath it that it won't dig into the cup. You can see how if something was hanging down, as we move the shoulder, that muscle right there could get pinched, but no longer. We located and tied the sutures for the biceps. We'll see if we can show you those. This is the rotator cuff, the bursal surface, and it looks good as we rotate the shoulder. But I want to see if I can show you the biceps tenodesis sutures also. Maybe hard because they were way anterior. Abducting, keep doing that. There they are right there, okay? So that's holding down the biceps. So we're all done here. We're going to finish up and get you back to the recovery room shortly. Good luck to you now. Bye-bye.